He went to bed the exact same way he had for the last 30 years, brushed his teeth, set the alarm, kissed his wife goodnight, and fell asleep within minutes, the way he always bragged he could. By morning, he was gone. No chest pain the night before. No warning that anyone in the house noticed. And when his wife finally sat down with his cardiologist weeks later, she learned something that almost nobody explains to seniors. The most dangerous hour for the heart isn't always the one everybody pictures. Clutching your chest, calling 911, rushing to the ER. For a very specific group of people, the most dangerous hour is somewhere around 2 or 3 inches the morning, while they're sound asleep, doing absolutely nothing at all. A quick note before we go further. This channel is for general education, not medical advice, and we're not your doctor. Nothing here is a diagnosis. Always talk with your own doctor about anything that applies to you. What we do here is read the actual cardiology research published in real journals, reviewed by real cardiologists, and translate it into plain language so you understand the why, not just a scary headline. Stick with us to the end, because the single bedtime habit connected to this isn't the one most people would guess. And it's one almost every household in America has without realizing what it's doing. Before we go further, tell us your age and what state you're watching from in the comments. We read every one, and it shapes what we cover next. Here's the piece almost nobody explains clearly. Most people picture a heart attack as a blockage, a clogged pipe, sudden and violent, usually during the day when the heart is working hardest. But there's a second, quieter pathway to sudden cardiac death. And it isn't about a blockage at all. It's about rhythm. Picture your heart like a drummer, keeping time for the whole band. Every organ in your body is relying on that steady beat to stay in sync. An arrhythmia is what happens when the drummer suddenly loses the beat, skips, stutters, or speeds up into chaos. Most of the time, during the day, your body has enough backup systems to catch that stumble and correct it. But there's one specific nighttime condition that removes those backup systems for minutes at a time, over and over, all night long, and it's called obstructive sleep apnea. The throat muscles relaxing during sleep until the airway partially or fully collapses, cutting off airflow for 10, 20, sometimes 60 seconds at a stretch, dozens or even hundreds of times in a single night. Here's the core distinction that this entire video is built around, because it's the one thing almost nobody connects to heart risk. Sleep apnea isn't just a snoring problem, and it isn't just a you're tired the next day problem. Every time the airway collapses, oxygen in the blood drops, and the heart senses that drop as an emergency. It has to work harder, blood pressure spikes, and the nervous system floods the body with stress hormones over and over, all night, every single night, for years, in someone who's never been diagnosed or treated. Cardiologists studying this exact pattern published research in the New England Journal of Medicine, led by Dr. Apurgami at the Mayo Clinic, that found something the general public still doesn't know. In the general population, sudden cardiac death is more common in the early morning hours after waking up. But in people with untreated obstructive sleep apnea, that pattern flips. Their sudden cardiac deaths cluster overnight, between midnight and 6 a.m. While they're asleep, that single finding is the reason we're making this video, because it means the bedtime mistake in the title isn't a food or a pill or a position. It's living for years with a treatable condition that nobody in the house realized was dangerous. Let's walk through how this shows up, one scenario at a time, because each one is a moment where the risk is quietly building and almost nobody recognizes it for what it is. The first is the one every family jokes about. Loud, heavy snoring, with pauses where it suddenly goes silent, followed by a gasp or a snort as breathing restarts. That silence isn't peaceful sleep. That silence is the airway closed and the oxygen dropping. Families hear this for years and call it just how he snores, treat it as a nuisance, maybe solved with a different pillow or a joke about separate bedrooms, when it's actually the loudest warning sign this whole condition gives. The line between nuisance and emergency here is straightforward. Occasional light snoring is normal and not a concern by itself. Snoring with witnessed pauses in breathing, gasping, or choking sounds during sleep is worth a real conversation with a doctor about a sleep study, not a new pillow. The second scenario is sleeping flat on your back, which is the single most common position for making this worse. When you're on your back, gravity pulls the tongue and soft tissue in the throat backward, narrowing the airway further. It's the difference between a garden hose lying straight versus one with something resting on top of it, gently pinching the flow. People who already have undiagnosed sleep apnea often have dramatically more of these breathing pauses, specifically when they roll onto their back, which is part of why some cardiologists recommend a simple, low-cost first step, a body pillow, or a specially designed shirt that discourages back sleeping while a proper diagnosis is being worked out. The third scenario is alcohol before bed, the nightcap that's supposed to help you sleep. Here's the mechanism. Alcohol is a muscle relaxant, and that relaxation doesn't stop at the muscles you can feel. It relaxes the throat muscles too, on top of whatever narrowing is already there, which is why research on sleep-disordered breathing consistently shows more frequent and longer breathing pauses on nights when alcohol was consumed within a few hours of bedtime, even in people who don't otherwise have a diagnosed problem. The fix isn't necessarily never. It's timing finishing any alcohol several hours before bed rather than as a bedtime ritual. The fourth scenario is the one hiding in plain sight in a lot of households. Someone was actually diagnosed years ago, was prescribed a CPAP machine, and simply stopped wearing it because it was uncomfortable, because it felt like a hassle, because they slept fine without it, as far as they could tell. Here's the honest, hard truth. Cardiologists want seniors to hear. You can't feel your own oxygen dropping while you're asleep. Feeling fine is not the same as being fine. The device sitting in the closet doesn't help anyone. Multiple published studies tracking cardiovascular outcomes in sleep apnea patients have found that consistent CPAP use is associated with meaningfully lower rates of high blood pressure, arrhythmia, and cardiovascular events compared with patients who were diagnosed but used the device inconsistently or not at all. This is associational evidence from observational studies, not a guarantee for any one individual, but it's consistent enough that it's now standard cardiology guidance. The fifth scenario is blood pressure that looks normal at the doctor's office during the day, but is actually spiking at night, something called non-dipping blood pressure, where it should naturally fall by 10 to 20% during sleep, and instead stays high or even rises. This pattern shows up disproportionately in people with untreated sleep apnea, because every oxygen drop through the night is also a blood pressure spike, and a doctor's office visit at 10 a.m. simply can't see what's happening at 3 a.m. This is part of why some cardiologists now recommend a 24-hour blood pressure monitor for patients with risk factors rather than relying on a single daytime reading. Here's where we need to be very clear about the difference between something worth watching and something that needs a call to 911. Right now, no waiting. If you or someone you love wakes up gasping with chest pain, pressure, or tightness, sudden severe shortness of breath, or confusion that doesn't clear quickly, that is a true emergency, and the action is to call emergency services immediately, not to wait until morning and mention it at the next appointment. Loud snoring alone, or feeling a little tired most mornings, is not an emergency. It's a nuisance sign worth bringing up at your next regular visit, and worth asking specifically about a sleep study. Consider a man in his early 70s. Call him Walter, whose wife had complained for years about his snoring and the strange pauses in his breathing that she'd learned to sleep through. He felt tired most mornings but chalked it up to getting older. It wasn't until a routine visit, when his doctor asked directly about snoring and witnessed breathing pauses, that a sleep study was ordered, and it came back showing dozens of breathing interruptions every single hour, all night, every night, for what had likely been years. Walter started CPAP therapy, and within months, his morning blood pressure readings, the ones that had crept up slowly over the past few years, came back down. Nothing dramatic happened in one night. It was the years of untreated strain finally being taken off the table. So here's why every one of these scenarios connects back to the same doctrine. The heart doesn't just respond to what you eat or how much you exercise. It responds to how well you breathe while you're completely unconscious and unable to notice a problem for yourself. That's what makes untreated sleep apnea different from almost every other risk factor on this channel. You cannot self-diagnose it by how you feel, because the entire event happens while you're asleep. Tonight's plan, in one sentence: if there's loud snoring, witness pauses in breathing, or gasping in your household, or if a CPAP machine is sitting unused in a closet right now that is worth a specific conversation with your doctor about a sleep evaluation, not something to keep waving off as a nuisance. Before you go, is there someone in your house whose snoring has pauses in it? Tell us below. It might be the nudge that gets someone you love to finally ask their doctor about it. And if this explains something nobody in your family's doctor visits ever had time to walk through, send it to the person in your life who snores exactly like this. It costs you nothing, and it might be the reason they finally get it checked. One more thing before we close. None of this is a reason to change any medication, stop using any device, or self-diagnose on your own. Always bring these specific symptoms to your own doctor who knows your full history. We've spent this video on what happens overnight in the body, but there's a daytime habit connected to the exact same risk that almost nobody links to it either. And that's exactly what we're covering next. Watch that one right after this.